For my presentation, I am going to be going over abortion. For our overview, we're going to talk about abortion, abortion rates in America, and the psychological impact. So abortion. What is abortion? Abortion is when a pregnancy is ended so that it doesn't result in the birth of a child. This is also called a termination of pregnancy. The most common abortion is a clinical abortion. The clinical abortion has two types, the vacuum suction and the dilation and evacuation. The vacuum procedure can be performed up to 15 weeks and the dilation and evacuation between 15 and 24 weeks. There is also an abortion pill, also known as an early medical abortion. The abortion pill is a combination of two pills that both stop the pregnancy from growing and flushes out the woman's uterus. Next, I'm going to go over some abortion rates in America. According to Jones and German 2017, in 2014, there was 926,194 abortions were performed in the United States. The abortion rate was 14.6 abortions per 1,000 women aged 15 to 44 years old, meaning that in that year, nearly 1.5% of women of reproductive age had an abortion. In 2008, it was estimated that 30% of women aged 15 to 44 would have an abortion by the age of 45 years if the prevailing rate continued, and this figure is often used to demonstrate the commonality of abortion. In 2014, 49% of abortion patients had family incomes below 100% of the poverty level, a significant increase from 42% in 2008. Low income and younger women have traditionally been at increased risk for unattended pregnancy and in turn, an abortion. Next, we're going to go over the history of abortion. According to Jones and German in 2007, the quintessential female reproductive body was transformed into a myriad of possibilities by the Supreme Court's decision in Roe v. Wade, radically shifting the bipolitical landscape of the nation. The ruling made all reproductive decisions contingent on a woman's right to privacy. Decisions continued on a woman's right to privacy, fixing the legal window for ending a pregnancy at the moment of fetus viability outside the womb in most cases. The Roe finding underscored scientific criteria and medical expertise as benchmark for access to abortion, basically leaving the decision on abortion to the woman and her doctor. The court ruled that the woman's liberty, right to control whether or not she is pregnant, is stronger than the state's interest in the fetus's life up until a certain point of the pregnancy. The Supreme Court added that a state might regulate abortion based on reasons other than concern for personal life. The Supreme Court said that the state could justify abortion regulation based on the concern for a woman's health, just not before the end of the first trimester. Next, we're going to go into the psychological impact. The Council of Representatives of the APA charged the Task Force on Mental Health and Abortion with collecting, examining, and summarizing the scientific research addressing the mental health factors associated with abortion, including the psychological responses following abortion, and producing a report based upon a review of the most current research. Women obtain abortions for many different reasons, at different times of gestations, and through varying types of medical procedures and varying types of social, economic, and cultural backgrounds. The different variables will lead to different psychological reactions. According to the study directed by Major in 2008, the few published studies that examine women's responses following an induced abortion due to fetal abnormality suggest that terminating a wanted pregnancy late in a pregnancy due to fetal abnormality appears to be associated with negative psychological reactions, equivalent to those experienced by women who miscarry a unwanted pregnancy or who experience a stillbirth or death of a newborn, but less than those who delivered a child with life-threatening abnormalities. The varying mental health outcomes are directly related to the planned versus unplanned pregnancy terminations. A woman who had to abort a baby because they were going to have life-threatening abnormalities put their physician equally wanted a baby than a normal mom and will have the same mental health reaction to the loss of someone who naturally or has a stillborn baby. Some research statistics by the Task Force on Mental Health and Abortion. There was a study that involved 353 women. The majority of those samples, 60%, were between the ages of 20 and 29, and non-whites were 74.4%. Had not graduated college, 76.8%. Had a yearly household income of less than $10,000, that was 64%. Had never been married, 77%. Most women had surgical abortion, that was 68%. And the first trimester abortions were at 93.4%. In the sample, 38.8% grew up with someone who had substance abuse problems, and 17.8% grew up with someone who went to prison, and 34.8% grew up with someone who was depressed or anxious in the household. And those are my resources.